Okay, good morning everyone. In today's video, we are going to discuss some definition related to susceptible TB after the treatments. So, what are the definition which comes under drug susceptible TB treatments? The first definition is cured. When we say a patient is cured in case of treatment outcome of drug susceptible TB, we can say that a patient is cured when the TB patient last month smear or the culture report should be negative. So if any TB patient, I mean a susceptible TB patient whose last month we take the sputum sample and send for the culture, and this report should be negative. So if last month culture report is negative, then we can say that a patient is cured. What is that definition of the treatment completed? Treatment completed means a TB patient complete his recommended duration of treatments without negative culture or the smear report. Okay, so when we say that a patient treatment is completed, the criteria is, first criteria is that patient completes its duration of treatments, and after the complete its duration of treatment, there is no any necessary requirement for the negative culturing of both culture or a smear. Only criteria is that patient completes its recommended duration of treatments. The third thing is the treatment failure. I mean, when we say a patient is the treatment fails, the patient whose a smear or the culture report is positive even after the month, even after 5 months of the treatments. 5 years, I think. So when we say a treatment fails, if the duration of treatment is more than 5 months, and after the 5-month duration we go for a smear or the culture and its reports come positive, then we can say that the patient is treatment failed criteria. Okay, when we say a patient is died, if any TB patient is died before starting the treatment or the duration of treatment, we call it a died. Loss to follow-ups. So a TB patient who did not start the TB treatments, or the treatment is start but interrupted for the 2 consecutive months. So if any TB patient who not start the treatment, or if the treatment is start, it is interrupted for the 2 consecutive months, then we can say that it is loss to follow-ups. And when we say that treatment is success, when cure plus treatment complete criteria are fulfilled, then we can say that a treatment success. So there are different definition of cure in case of the drugs resistance case. So what are the definition of cure in case of the drug resistance case? First is the patient completes its the treatment duration and no any evidence of the treatment failures, and after completing the intensive phase, 3 consecutive sputum samples are collected at an interval of the 30 days, and this culture should be negative. Okay, so whatever they told, in case of the drug resistance TB, there are the 3 criteria. First criteria is that the patient completes the recommended duration of the treatments. The second thing is that there is no any evidence of the treatment failures, and the third thing is that after the intensive phases we collect a sputum sample in a 3 consecutive manner at a difference of 30 days, and these all reports should be negatives. So this all about the treatment definition for the drug susceptible TB. Okay.